Hi teachers and parents, my name is Chantel Jordan and I'm the Centennial Counselor for the district, and this is Jill Schlatter, your school counselor for Beacon, and we just wanted to film this so that you guys could have a better understanding of what my role is as a Centennial Counselor and what her role is as a school counselor.
So my role as a school counselor here at Beacon is to support all of our students. I always tell our students that it's my goal that they are safe, happy, and healthy while they are here. So I work with all of our students in classroom lessons. I also work with small groups of students based on a common need, and also can meet individually with students. Another huge part of my job is connecting our families with resources, whether that be food or assistance when things might be, there might be gaps, and also helping to promote a positive school culture here at Beacon.
And then my role is I provide services for mental health prevention, and so we are funded by the Franklin County Adam Board. So all of the services that we provide at school are free to parents, and I work with students grades K through 5 doing a lot of different things. And I'm a licensed mental health clinician, so I have that mental health background. So what exactly is prevention? So it kind of falls on a spectrum. So that kind of sliver of promotion is where our school counselor falls, where she is working, like she mentioned, on promoting a positive school culture. And prevention is really working on preventing a mental health disorder from occurring or preventing it from getting worse. So doing a lot of different things, whether it's classroom interventions, meeting with students individually and in groups, or even a little bit further on doing more of that treatment based as we're bridging a gap or waiting for a student to get linked with outpatient counseling. So the goals are really to help students make good choices. We're helping them develop coping skills, increasing their utilization of those coping skills, providing education on different mental health disorders and how they can use those coping skills to help with that. We really want to reduce the instances of mental health and delay any onset of any substance use in youth as well. And it focuses on time-limited services. So I'm meeting with students for 5 to 7 sessions for about 20 to 30 minutes at a time. And then anything beyond that, I'm talking with parents about potentially referring for other services. But it's really just making sure that they have those skills. So prevention is not a mental health diagnosis. I'm not diagnosing students here. Again, it's focusing on making sure that they have the coping skills that they need. It's not an on-call crisis risk assessment. So there are services that if you are concerned about a student's safety, you can contact Nationwide Children's Hospital or other places to be able to talk to them about if you're concerned about a student's safety. It's also not immediate linkage to counseling. I can certainly help fill that gap or refer students, but I can't necessarily just get them straight in. And it's also not a substitute for a higher level of care. If a student needs outpatient counseling, the services that they're going to get in prevention are not going to meet that need. All right, so when to refer. So when you're in the classroom, there are things that you can try, and Jill can maybe mention a little bit more about the services that the classroom teachers can try first.
Yeah, so each of our teachers here at Beacon have a calm down spot or calm down corner in their room, and that consists of maybe a rug or a pillow that's in a specified area, and there is usually a chart that gives students options of strategies to try. So they could try deep breathing, they could try counting to 10, thinking of a happy spot, and most of our students have been taught these strategies in classroom lessons, so it's kind of up to them to utilize those strategies or need to be reminded of those strategies. Our goal is to try to keep students in the classroom as much as possible, and learn to kind of regulate their bodies and their emotions when they need to. Of course, there are instances when kids may need a higher level of support, and certainly we would take them out of that environment. But if we can keep kids in their room using these strategies that they've been taught, it's kind of a win-win for everybody. It also helps the kids build resiliency, and helps them to better learn how to cope when they're having kind of an emotional blip in their day.
And then if you wanted to refer a student to services, then you would just meet with your school counselor, and if you are going to email her using the student's initials only, and then her and I can have a conversation about whether or not that student would benefit from meeting with her or moving into Centero's prevention services.
And internally here at Beacon, we've really done a lot of work to kind of tweak our RTI process, which is response to intervention. So that is certainly a process that our teachers know how to follow if they are concerned about a student, so that we can put interventions in place for them.
Okay.
So our teachers really are our first line of defense. You guys are the ones that are working with your kids. You know them the best. They feel most comfortable with you. You're with them 7 hours a day. You are their safe spot. So sometimes our kids need just someone to listen to them. So if we can take that extra moment to try to talk through what they're feeling in the classroom, that is the best thing. And to really remind our kids it's okay not to be okay. Sitting, like I mentioned, sitting in their discomfort is where we build skill, and it's not a bad thing. And please always ask for support. You know where we are, you know where I am. Sherry and Matt are also great resources, and we can certainly help you when you need it.
So I mentioned earlier there were numbers that you can contact if you are concerned about a student's safety. So for anyone 17 and under, you would contact Nationwide Children's, and they'll walk you through the process, ask you more questions about the student, and then they can help you determine the next steps for that. Anyone 18 and older would go to NetCare. There's also OSU Harding as well. For teachers, if anyone's concerned about a student, definitely come talk with me or Jill or Matt or Sherry before calling any of these numbers, but that is just a resource that we wanted to make sure that you had aware. I mentioned this earlier, but the frequency of Centero's prevention services is that 5 to 7 sessions, 20 to 30 minutes, and again, focusing on skills building. Another just kind of point to make is just because a student received prevention services last year doesn't automatically mean that they're going to need it again this year. We can certainly look at each student every year to determine what types of services they will need, but it doesn't automatically just put them on my caseload this year. We really want to make sure that we're talking with parents and making sure that they've either learned skills over the summer. They may just not necessarily need me right away. And then prevention services end. So when students demonstrate that they've learned the appropriate skills, they've been successfully linked with other services, so maybe we were able to get them into outpatient counseling, or the family has just decided that they would no longer prefer the services. So that's when they would end.
So groups are coming. Many of the teachers have filled out already a needs assessment. Thank you for doing that. We had an overwhelming response of kids that could benefit from some extra support. So Chantel and I are working through that right now, and that involves sending permission slips home to parents, getting approval, and then setting up some groups. We'll be talking with you to see good times that would be a good time to pull your kids out. So please be patient. We're working on that, probably another couple of weeks.
All right. Thank you guys so much. I hope you guys learned.
Thank you.